All right, so I'm going to go ahead and get started. And as people come in or continue to come in, we can keep admitting them to be sure. Good evening. My name is Erica. I'm the adult specialist with the St. Louis Public Library at Central in the Science and Technology room. And this evening, we're going to have a delightful but frank discussion about breast cancer health, and resources available to us all, brought to you by Gateway to Hope and some of their friends. I would like to take a moment to introduce our friends from Gateway to Hope. We have Melanie Gowdy and Heather Burns. And Melanie, I have to take my glasses off so I can read this here. Melanie Gowdy defines herself as an equity advocate, specializing in community practice. Melanie empowers communities through the pursuit of social justice. Much of her career has focused on promoting health equity in Missouri's public safety net programs by informing programming that provides direct application assistance, developing localized training and evaluation processes for the Missouri Department of Social Services, and empowering communities to advocate for institutional accountability. She recently coordinated the successful pilot of Legal Services of Eastern Missouri's Medicaid Monitoring Project in partnership with the National Health Law Program. In her current role as the Director of Community Mobilization and Engagement at Gateway to Hope, Melanie is leading the formation of a statewide, community-led coalition to address breast health disparities that leads to Missouri's breast cancer mortality rates being higher than the national average. Melanie acknowledges the eclectic nature of her practice and identifies the pursuit of equity in all spaces as the common thread. Melanie, if you're there, will you wave at the screen?
Hey, I'm here.
And then I'd like to take a moment to introduce Heather. Heather Burns, during her social work career, has made several lasting connections as an individual who is willing to listen to individuals and the community and design programs around what stakeholders express as their own needs. In addition to this, she brings years of experience providing direct clinical services to individuals who have a chronic or terminal illness diagnosis. As the Director of Programs at Gateway to Hope, Heather leads the agency's efforts in programming development, overseeing implementation of services, and determining agency outreach strategy based on the unmet and prioritized needs of the community in which Gateway to Hope serves. So those are just some brief introductions of our friends who are going to be leading the program and discussion this evening. Ladies, I'm going to let you take it away. I thank you so much for coming tonight.
Oh, well, thank you, Erica. I'm okay. I'm not muted, right? I think that's like my number one thing is I always start talking and forget that you're muted. I should be used to it by now. Like we're 2 years into the pandemic, like get it together. But thank you so much for inviting us to participate in this. You've been an amazing partner. I really love talking with you and figuring out like what type of program that we could put on to help our community. So thank you so much for being a valued partner and definitely respected and valued advocate. So thank you so much. I don't feel like I need to do any introduction because you you did it. I gotta shorten it. That's like too much, and it's really hard to live up to. Like, what do you say after all that? But thank you for this opportunity. I'm Melanie Gowdy, and I'm here in the capacity to help provide information about Gateway to Hope and about breast cancer awareness, particularly what do we do, what can we provide, what information can we provide, what services can we provide to really make sure that everyone in Missouri has the best chance to getting the best outcome. So that's what Gateway to Hope is all about, making sure that we're being responsive to the needs of the community. And in my role as Director of Community Mobilization Engagement, that's what I do. So I make sure that we as an organization have a presence in the community, make sure that we're talking to everyone, stakeholders, individuals, policymakers, to make sure that whatever breast cancer intervention services that are provided are appropriate and are equitable to everyone in Missouri. So we believe that no one should have their health determined by their race, ethnicity, income, or any other identification in life or characteristic. Everyone should have equal access to healthcare and quality healthcare. So what I'm going to do is turn it over right now to my amazing partner in crime. I mean, just look at her. She's so amazing, and I get the pleasure of working with her every day. She is my partner in crime, but she's also an amazing partner in advocacy and health equity. So I'm going to turn it over to no other than Heather Burns.
Thank you, Melanie. You give me way too much props. I don't even know the right word for it, but thank you. I appreciate that. And it's a pleasure. Oh my goodness, I just said it. See, I have my wild trees in here and all these bugs are flying in my face. I just had a gnat fly in my face. Erica, yes, thank you so much for giving Gateway to Hope this opportunity. We're really excited to see where this partnership with the St. Louis Public Library can go and build off of. So we're super excited and just gracious for that, as well as our community partners that are here. Valita, it's good to see you. I hope you've been well. Thank you so much for being here tonight. And Ms. Driver, I haven't had the opportunity to meet you before, but I'm looking forward to getting to know you and your work a little bit better tonight. So as Erica mentioned, I'm the director of programs, so I oversee the direct client facing programmatic work that happens at Gateway to Hope. And so what I was going to do was share a little bit about sort of the breast health landscape, which those of you here I'm sure are pretty familiar with, and sort of what we are currently doing about it and what we plan to do about it in conjunction with Melanie's work. And then Melanie will tie that in with her presentation along with the community partners who are here today. So I'm going to try and follow, where's that phrase you use, Melanie? I'm going to try and share my screen without sharing my business. See if I can manage that right. Hang on. Okay, so, yeah, let's see. Okay, I think I am figuring it out. No, that's not what I want to do. I'm sorry. Let me try this again. Present. Yes. Okay. Your screen. One. You're gonna see yourselves for a second. My apologies. Okay. Can everybody see this? I can't see you all, so if you give me a, somebody could unmute and just confirm.
Yeah, we can see it.
Totally see it. Yep.
Perfect. Okay. So I'll get started. So one of the things that I feel is important to, is this on, can you, I'm gonna move that too. One of the things that I think I'd like to start with is just talking a little bit about Gateway to Hope's current mission, and present to you all our current mission statement, which you can see here is to remove barriers to affordable, timely, quality healthcare, empowering people with breast cancer to face the disease and focus on healing. This is our mission statement, and we've been working over the last several months, especially with Melanie and some other new staff members who've joined our team, to really drill down what do we mean when we say this. And I think in the next few months, likely into the new year, we will courageously and excitedly roll out sort of what our approach is going to be, new mission statement, what our values are, where we stand as an organization, and just that will help to inform our approach, help keep us accountable, and just help to give the community a better sense of who is Gateway to Hope, what do they stand for, and what are they doing. So while this is our current mission statement, I just wanted to share that we have a lot of work going on right now, and you can expect to see this change. Still serving individuals with breast cancer, that will not change whatsoever. Just really being more clear with our approach and our work, so that it's clearly stated to community stakeholders and community partners. So just a few breast cancer basics that I like to share before getting started. So at any point in time, about 5,000 people are diagnosed in Missouri a year with breast cancer. So about 98% of those are women. There is a small population of men who are diagnosed with breast cancer. We see disparities show up the worst in the country here in St. Louis County. I'll talk a little bit more about the disparities as we get going, but it's alarming for myself and for many I know who are on this Zoom call to which is what is inspiring our work to be here tonight and just to address not only the disparities in breast health, but just in all of the healthcare inequities that show up here in our region, which happen to unfortunately be some of the worst. 35% of women in Missouri 45 and up are not up to date on their mammograms. So quite a big chunk of individuals, and the assumption can be made that for younger women who are higher risk, that number is even greater, who are not up to date on any kind of screening or mammography. Mammograms can detect cancer 2 years before ever detected through a self-exam or even a clinical breast exam. So they really do save lives, and prevention is the early detection is the biggest form of prevention for breast cancer. Breast cancer has an incredibly high cure rate if it's detected early enough. So it does not have to be a death sentence or, but unfortunately, because of issues such as access to care, we see these late stage diagnoses and mortality rates show up in our community. You do not need a family history of breast cancer to be at risk. So that's a really big misconception that, if none of your siblings or loved ones have had a breast cancer diagnosis, then you're not at risk, which is not true. And we can talk about some of the risk factors here next. So some of the risk factors for breast cancer that you cannot change. So age, as you age, your risk increases for breast cancer. Just another little fun thing about getting older. Add that to my, Asper cream on my lower back and Aleve that I take on a regular basis. So another fun thing to watch for, but it's just important to know, right? Although I think it's also important to note that there are some young people, especially women of color, who are more at risk at a younger age, especially for developing more aggressive types of breast cancer. Genetic mutations, such as the BRCA1 and BRCA2 genes. We have a couple of genetic counseling programs in the St. Louis area. I believe MOBAP and SLU University are two, and I think Mercy has one, so potentially possibly three. Recently, WashU released a study that talked about the how there's disparities that are showing up when it comes to genetic mutations. Women of color are less likely to be referred to genetic counseling than white women. So there was a really extensive research study just shared regarding that within, I want to say, the last month. And it was just sort of affirms things that we already know that show up in our community about biases and racism in practice. But imagine if just connecting somebody with genetic counseling, like that could be a matter of life and death if they determine that person has a BRCA gene or some other mutation that makes them more likely to develop one of these cancers that are easily treatable or curable if they're detected early enough. So your reproductive history, and what I mean by that is the age in which somebody starts their menstrual cycle, that's a risk factor, and it's something you cannot change. Breast tissue density, can't change that, unfortunately. That's why 3D mammograms are so important. everybody's bodies are differently, and screening is differently. So the 3D mammograms are really essential because they can see things a little clearer than traditional mammograms. Personal history of breast cancer or non-cancerous breast diseases. That's something you can't change, unfortunately. And a family history of breast or ovarian cancer. Just a couple things you cannot change, but there's things you can change. Things like your weight, how physically active you are. Dr. Lannis Hall, who I admire greatly, and who is a breast cancer, breast health expert of all the experts in the St. Louis area. If you haven't had an opportunity to hear her speak about breast health and breast cancer, find a way to do so, because she's a really incredible speaker. But I'll never, when it comes to physical activity and weight, there was something that she had shared in one of her presentations about how fat is essentially a hormone, right? And like, we need some fat on our bodies, but when you're overweight or you have too much fat on your body, right? That's a hormone. And there are some cancers, breast cancer being one of them, that are essentially fed by excess hormones in the body, certain subtypes of breast cancer. And it's just really, like, hearing her, an expert like that, wording it that way, just really drove it home for me, like how important things like physical activity and weight management are. So I personally have struggled with both of those things, especially since the pandemic, even before my whole life. But it is something that I'm really mindful of, and I do think about that often as it relates to the work I do, and just how important it is for managing my own health, and you know, those around me, if they're, you know, asking me for things that they can influence, right? On that same note, hormonal supplements can potentially put you at risk. Drinking alcohol and smoking cigarettes, that's always, the drinking alcohol one is always kind of a wah for folks when we share this information, but it does increase your risk for developing breast cancer, among other things. And something else you can change, the narrative in terms of how you have conversations about your risk, and when you should begin screenings with your doctors, and you know, gaining your family history. Those are things you can change or attempt to change. There's a few different risk assessment tools out there. There is not one specifically that Gateway to Hope endorses, but a conversation with your primary care provider or an OBGYN, it can help determine what is an appropriate age. I just dropped it. What is an appropriate age to begin screenings? Because there's several different governing bodies who have different recommendations. Gateway to Hope does support beginning screenings every year at the age of 40. However, really being mindful of risk. So if you had a first degree relative, so say a sibling or a mother, or even a father who was diagnosed with breast cancer at 44, you would want to start screening, a baseline screening at 34. So before that 40-year mark. It's really important to have those conversations so you can have a personalized plan for how you will prevent breast cancer, or detecting breast cancer early, rather. So extremely important. So to talk about the disparities here, I mentioned them a little bit before, but again, St. Louis County, we're #1 in the nation for mortality rates between Black and white women, specifically in North County. So we see that Black women are twice as likely to die from their breast cancer diagnosis than their white counterparts in the same zip code. And for younger Black women, so ages 35 to 44, they're 4 times as likely. So again, pretty alarming. That's always the first word that comes to mind when I just see those stats glaring in my face, and just when I'm speaking about them. And again, pulling from Dr. Hall, because as I said, I admire her work, and have had the opportunity to hear her speak several times. where you live should not determine if you live. So I grew up in North County, and so not only, is that this near and dear to my heart because it's a community that I love and was a big part of who I am, but that women and women of color specifically are faced by this alarming disparity. It's just it hurts to know that that's happening. And so it really ignites my work and my passion to try and do something about it alongside my colleagues, Melanie joining the organization and her work, which she'll talk about too, to help address some of these disparities that exist. And to, why do these things happen? Why do these things show up in our community specifically? Well, it has a lot to do with social determinants of health. So these are some examples of social determinants of health: environment, safety, hunger, access to care, housing, mental health, transportation, education, income and jobs, isolation, right? We've seen that. That has been a huge social determinant of health that I think is even going to show up even worse as a predictor of poor health outcomes here in the future, especially as it relates to cancer screenings and the closure of facilities, or the backlog of facilities who do the screenings as a result of isolation or shutdowns. We're going to see some exacerbated late stage diagnoses. We're predictably, hopefully not, but we're anticipating things along that line. So the access to care, that is huge, and that's what I think mostly shows up in this conversation. But all of these things fit together, right? We take a very person-centered, holistic approach, and consider all of these things and how that may impact somebody's health outcomes. But I think this access to care is really the one that we focus on quite a bit, along with the mental health and everything that brings this whole pie together. But these are just some examples of what that looks like. And when we talk about health equity, like, what does that mean, right? Health equity, you can see the definition by the CDC here. Health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of their social position or other socially determined circumstances, right? So like those social determinants of health. None of this should affect what type of care somebody receives in terms of their healthcare needs. It shouldn't, for anything, but more specifically for health, none of this should matter. None of this should matter in terms of what type of care or access to care somebody has. But it does, unfortunately, in the systems that were built to sustain that sort of inequity, right? So here's some examples of again, sort of piggybacking off of the social determinants of health. These are the inequities that we see that result in some of these differences in care. So race, ethnicity, gender, sexual orientation, socioeconomic status, disability status, where they live. And I highlighted that, right? Because that's what we were just talking about for the St. Louis region. So it's a huge, huge burden in our community, and through the work of other organizations who are bound and determined and to work to eliminate these inequities. Hopefully we see some of the numbers flip the other way, right, in the St. Louis community specifically. So now I'm going to talk a little bit about what the program is at Gateway to Hope, and sort of the program evolution in terms of where our program started and sort of where it's going and where it is today. So Melanie, do you want to share the clip of Natasha?
Sure. And we have a question in the chat if you want to answer. Okay.
Sure.
So what is the BRCA gene?
Yes, so there's two genes that have been found that have a correlation with gynecological cancers developing. So, or breast cancer. So the BRCA gene can be looked for in genetic counseling services. Again, I mentioned SLU, MOBAP, and Mercy having those available. But they're genes that are connected specifically with the developmental of breast and other gynecological cancers. So some families that have a family history of breast cancer test positive for the BRCA gene, and then they can potentially pursue elective procedures to help them, if they want to do a hysterectomy or do a bilateral mastectomy to help lessen their likelihood of developing those cancers. Or some families like my own, we have a very strong family history on my mother's side of breast cancer, but we are not BRCA positive. So lots of research going on to hopefully identify other genes, because as you can imagine, there's more research that needs to be done to determine what other genes are associated with the development of breast or other gynecological cancers or cancers in general, but specifically to breast. We know that there's more out there, and hopefully research can just improve to help find that information out so people can be more proactive and get that preventative care need met.
Thank you. Thank you. Do you want to go ahead and show the clip now?
Yeah, that'd be great.
Okay, so you're gonna hear it straight from my mouth. I'm gonna try to share my screen
Okay.
without
Right.
sharing. My
That means I need to stop share, right?
That's a good question.
Okay. I'm gonna pause my share.
Okay.
Tell me what that does. Anything?
Oh, I think I can do it from my end too. I can stop your share. I can.
Oh, okay.
Okay.
Look at us learning.
A new skill.
Yeah.
Okay. So do you all see this beautiful individual here? Do y'all see my screen?
Yes.
Okay. All right.
Unlike many others, I never felt sick. I didn't have a lump. It was just a gut feeling that something wasn't right. I got angry because I went to 3 different specialists who told me it was nothing and that I was just worrying about nothing. I decided that I was going to fight and not give up. And I'm sorry. The first time I told my story, I received the diagnosis that I had breast cancer in my left breast with susceptibility that was also in my right breast. And then my world just kind of went blurry. There are amazing people at Gateway to Hope that will help you navigate this entire process because it is unknown territory, and for me it was. And it was just great to be able to receive information and to receive resources that I had no knowledge about prior to this. I do think that Gateway to Hope is a breast cancer lifeline. They're there to get you through this journey, and they're walking you through this process, which has a lifelong impact on you in itself.
Thank you, Melanie, for sharing that. Now I'm going to figure out how to reshare my slides. But before I do that, so Natasha, I had the privilege and honor to work with Natasha and really get to know her and her journey. And it ties really unique. Her story ties, almost serendipitously in a bad way with the healthcare inequities that show up in our region. So Natasha had to go to 3 different providers before she could actually get the proper diagnosis. She didn't detect any lump, and she had a mammogram done, and there was something on her mammogram that was a little concerning, but the providers had brushed it off. We're like, oh, it's this or that. It's no big deal. But to Natasha, she's like, no, something's on my mammogram. That is a big deal. So unfortunately, like I said, she had to go through 3 different providers before she got to one who took her seriously and actually performed the biopsy. And then she was diagnosed with triple negative breast cancer, which is one of the most aggressive forms. So she is in remission now, I can happily say. But, you know, just that journey, and she's a woman who has resources, right? She has insurance. She has, you know, she has a really strong support system. She has all of these things at her disposal. She has experience navigating the healthcare landscape just in different variations throughout her life, and yet still she had this struggle to even just be taken seriously. And I mean, and Natasha will say herself that she knows that was because she's a woman of color and her needs were not taken as seriously. And luckily she continued to advocate for herself to where she did get that proper diagnosis and caught her cancer early enough to where it was curable. So she's a wonderful advocate, and just so honored to even have met her. So we wanted to share her story a little bit because I think it's really important to sort of make these connections with the social determinants of health and healthcare inequities, and then just sharing a little bit on about our program. So now I have to figure out how to share my screen again. Let's see. I did that before. Okay. Oh, where'd my Zoom people go? Okay. Okay, there we go. So about our program. So our program team is made up of social workers, and every person that comes to our program is paired up with one of our social workers, which we refer to as our patient navigators. And what they focus on is the emotional support and education piece that comes up during somebody's journey. So what we mean by that is breast cancer, even though it's a slightly common diagnosis, it still can be isolating when somebody receives that diagnosis, especially for those who may not have loved ones or friends to help support them through that. But even for those individuals who they do have a strong support system, or maybe they are the backbone of their family and they are the one who's constantly providing support, they may not feel that they can go to others to support them, because even through their breast cancer journey, they're still supporting their own loved ones who are struggling with their diagnosis. So
Heather,
yes.
I'm sorry to interrupt, but the screen that you're sharing is black.
Oh, that's helpful.
I know you probably have a fabulous screen with fabulous slides. So I'm make sure we all see it.
Let's see. How about now?
It just says has started screen sharing, but it's black. It's not an image or anything on it.
All right.
You know what? I think no. I'm trying to see if it's me. Oh no.
Not you. It's not you, it's me. Famous last words, right?
Erica, you got any advice? Any suggestions?
So Melanie, if you try sharing this, if you pause the screen share, try unpausing it again, or restarting, resharing.
Okay, so just share my screen and then stop sharing it.
Well, share your screen and then let's see if that kicks it back off again or starts it back up again.
Okay. So do y'all see my amazing background, all these mountains?
I do. That is pretty.
It's my goals, right? And then stop sharing or pop.
And see, now let's see if Heather can share hers again.
Okay.
Stop.
Zoom is hard.
You want me to stop sharing my screen? How about I stop? And you think that'll?
Yeah, give it a shot. That one. Okay. And then, all right, Heather, give it a shot.
And I will try doing this again. Yes? No?
It wants to share whatever it is you've got. It's just a black screen. That's so strange.
Let's try this. Anything?
Not yet.
So Heather, when you press screen, I guess share screen, what do you see then? Does it take you to like this white background with different screens?
So, yes.
Okay. And then does it give you the option to select one of those screens to share?
Yes.
And on one of those screens, your slides?
Yes.
Okay. And then when you press it, it still doesn't do anything?
No, ma'am.
Ooh.
Try again. Hmm.
Trying to see if I like did anything. Oh, wait, how about this? Anything?
No, it still says the same thing.
All right. Well, you all don't need to see my slides. I'll just talk and we can share the slides later. Just because I don't want to monopolize time. Because we're scheduled to break at 5:55, right?
Correct.
All right. So talking about the Gateway to Hope team, what somebody can expect or what you all could expect from the program team. So that emotional support piece, that's a huge component of our work. We have some different interventions and some different programming that we are actually developing right now that we'll begin implementing. So our approach will have evidence-based practices that we draw from to ensure that we are implementing the right strategies at the right time. The education piece, we talk with individuals a lot about their treatment and what that means. We do not claim to be medical experts, and we do not provide any sort of medical advice. We help people basically structure what sorts of questions they have and directing them to the appropriate individuals on their medical team or another resource in the community who is able to answer more of those medically specific questions, because it is outside of our wheelhouse and we recognize that. Breast health, we are also entering into a space where we'll provide support to individuals who are trying to locate a screening site. So that work will encompass a few different things. One, just helping them locate a mammography site in the whole state of Missouri, not just St. Louis. And, just talking with them like what they can expect at their appointment, or if they're uninsured or underinsured, what sorts of programming exists in the state of Missouri that can help them get that screening and not be so concerned about the financial aspect, right? Like if that screening comes back abnormal, then what? So we talk with them extensively about the Show Me Healthy Women program that exists in the state of Missouri for uninsured and underinsured women seeking cervical or breast cancer screenings. It's not an easy to navigate program. So, and I think Melanie might touch on that a little bit, but our work centers a lot on just empowering individuals with the information they need so that they can navigate this super complex healthcare landscape and in community that exists here in St. Louis specifically, but all across the state, so that we can help reduce the disparities, help increase women in rural communities, access to care, just all of these things that we know that we have the capabilities to do if we just organize and take some strategic efforts. We also make a lot of referrals. And by a lot, I actually just ran the numbers, and we've made close to 1,000 referrals this year to other community organizations or national organizations that supplement maybe financial assistance that goes beyond what we can provide, or brings in things like to address food insecurities or housing, all of those sorts of things. So we make a ton of referrals because we can't do this work alone, and we recognize that. So partnering with other community organizations and entities throughout the region and throughout the country are extremely important. I spoke about the navigating the healthcare landscape. Another big element, we serve as a bridge between the patients oftentimes and their medical team. So the biggest example I can share of that is we have about a third of all of our patients who are living with stage 4 breast cancer. Palliative care and hospice care are something that aren't always introduced early on to somebody's journey with a stage 4 breast cancer diagnosis for a variety of different reasons. But we had a patient who was living in a rural community. She was in her early 80s. She was on a treatment that she was taking at home. It was a pill that she was taking at home. And she had a lot of fear about the upcoming winter months and how she was going to get to her oncologist office that was like over an hour away, which in a rural community is not that far. But when you add that to some of the rural road conditions, things like that in winter, that can make for a pretty scary journey. So I talked with her extensively about how palliative care can be really beneficial to someone like her, because she could still pursue treatment while receiving palliative care. And she was interested, and I spoke with her social worker at the hospital, and we made a coordinated effort and got her a referral to palliative care services. So, again, for this individual who had not a lot of social supports, again, in a very rural part of the state, she needed that extra support from a medical team that palliative care could give to somebody like her with a stage 4 breast cancer diagnosis. So the collaboration piece with community partners like yourselves and healthcare providers, I mean, it's essential to us being able to do some good work. So talk a little bit. I'm assuming my slides still aren't being able to be shown, right? Is that accurate? Okay. So I'm still reading off of them as though you can see them. So a big component of our programming is the financial assistance that's available. As I mentioned, the navigation support, which through some program evaluation, we've learned that the patients who receive the most navigation support from us have the better health outcomes as it relates to their treatment and lower distress. So that is really crucial to our work. But the financial assistance is often why people come to us. They hear about the ability for us to assist with maybe medical bills or basic living expenses like rent or mortgage or utilities. So that's often why somebody is referred to our program. So we do have financial assistance available for those who have an active breast cancer diagnosis and are inactively, and those who are in active treatment. Excuse me, I jumbled everything together. So that is available for individuals. There are some income guidelines, but we work with all different types of situations. So even if maybe somebody's income was, over our threshold 6 months ago, but now they're not working anymore, we will make an exception. Like, we want to know what somebody's financial situation is now, not what it was, 6 months ago, or even 6 weeks ago in some cases. So very, very flexible there. So the individual does have to be living in Missouri or Southern Illinois to have access to the financial assistance piece. And they can self-refer. They don't have to be referred by their medical team. So while most of our referrals do come from the hospital systems, whether it's a social worker or nurse navigator or navigator through the hospital, individuals can refer themselves to our program. So I'm still reading things like you can see it. So year to date, we have served over 300 women, which is exciting because last year we saw a pretty dramatic dip in our overall patient numbers, which we know was connected to the pandemic. So really encouraging to see that those numbers have increased. And the majority of our patients do live in the St. Louis region, about 75% of them, and about close to 30% of all of our patients live in the North County and North City areas. On average, like I mentioned earlier, about a third of all of our patients that we serve are living with stage 4 breast cancer. So there's some unique needs that exist with that population. So we're working on some very specific programming that we'll be launching later this year, beginning of next year, to really make sure that we're hitting all of the points that our stage 4 patients have told us in which they need services. We did some community needs assessment rather, but on an individual level with all of our stage 4 program patients, just to get an idea of like what are their needs, where do they feel that they could use more support, and we use that information to help us build out a program that we're really excited about launching. Hey, yeah, I'm reading from slides. So I think the biggest takeaways when it comes to breast health specifically is, again, knowing your own risk level, talking to your loved ones about their history. There's some communities who are much more private when it comes to their health history, but it's so important for these conversations to take place with loved ones so that you can know your risk and know when it's appropriate for you to begin being screened for not just breast cancer, but any sort of cancer or chronic illness or anything like that. Telling those you love about the importance of determining their risk and the importance of screenings, right? Again, early detection is the best form of prevention. Referring them to organizations like Gateway to Hope, Valida Keys, her group that's here tonight, the Breakfast Club, all these great organizations in the St. Louis region. And then there are organizations even beyond the St. Louis region that exist as well. Following, these organizations on social media, the library specifically, like I was so impressed with their Facebook presence after this partnership formed. Like there's some really amazing resources that the St. Louis City Library shares, and now I'm like super excited that I follow them on social media. Supporting advocacy efforts. So again, Melanie's going to talk a little bit more about this here when she gets started. But so huge, like we can't make change and we can't address these inequities alone. Like everybody, we need all hands on deck to make some really coordinated change. And with that, any other questions about any of my last slides that nobody was able to see?
Yes, so we have a question. What is a good way to start one of those sensitive conversations with your loved ones if they are hesitant? I love this question because it's not just about breast health care, it's about so many health issues. So amazing question.
Yeah, I think it's so important to, one, know your audience, right? Like if you know the person you're going to approach is hesitant with sharing that information, know that going into it. Although the conversations are important to have, and you would hope that the person on the other end would share honestly and openly, still have to understand that there may be some really tough layers to peel away to get those conversations to take place. So I always love the approach of going into situations with an open heart and assuming that the other person has positive intent. Really just knowing what your loved one's approach is really helpful in preparing for that conversation, because I think it is something to prepare for. The timing of when you approach that conversation, I think, is also key. Obviously, if that person's going through some sort of crises, it may not be the best time to approach them to have that conversation. But you know, why you're the why, right? Why you're asking that information is super important. Like, what is, you know, let's just say it's your grandma, like, grandma, I'm coming to you. I need to learn this information so that, you know, I don't have an early demise like your friend, like maybe pulling a personal example to somebody that they may have lost to, you know, a disease like this or something similar, to really help inform that conversation can be helpful. So like I said, open heart, assuming positive intent. It's not always going to be easy, especially if there's other dynamics that exist in that relationship with that person prior to you even having this conversation. So it's challenging, but it can be so, you know, the benefit can usually outweigh the risk in those scenarios.
Thanks. Thank you. So we have some questions about palliative care. So what is palliative care? And Belita, love it. It gave us an amazing answer. Palliative care is a medical care that relieves pain, symptoms, and stress caused by a serious illness such as cancer or heart failure. Do you find that when you bring up discussions about palliative care, people automatically go to like thinking of end of life? And are there other points that this type of care could be very helpful for someone who has breast cancer?
Yeah, absolutely. Thanks, Valita, too, for adding that definition. That is super helpful as I'm starting to like turn into Kermit the Frog here with my voice. So palliative care, yeah. So what we learned just this year in some of the conversations that we had really intentionally with our stage 4 programs is that a lot of folks don't know what palliative care is, but they're really interested in learning more. So, and that will be something like one of the pillars of our stage 4 programming will be a palliative care, hospice care education component, because it doesn't happen in the medical community to the extent that it should be. Anybody with this type of diagnosis is, you know, eligible to receive palliative care services. It's essentially booked or billed rather as a medical, as a mobile doctor's visit. Palliative care teams usually consist of a nurse and a social worker, and they can work in conjunction with the medical team that's managing somebody's cancer care. So for individuals who have very little social supports or support in general, services like palliative care can be extremely crucial to bringing in that extra layer of support. And, you know, unfortunately, stage 4 breast cancer is not curable. There are several treatment options, and it is somebody's personal choice in terms of what options they will pursue and to what length. But at the end of the day, unfortunately, stage 4 breast cancer is incurable. So getting connected with these services early on can, you know, help alleviate crisis care that may come up, you know, if symptoms present themselves and as a result of, you know, the disease and somebody going to the emergency room, right, unnecessarily. Like, so palliative care, hospice care, like making those decisions and having that information to make a decision if those programs are right for you can essentially keep you in control of the care you receive and the care you proceed with. So I think that is one of the biggest points that I try to stress to folks who are sort of wrestling with that decision is this helps keep you in charge of what happens to you, because palliative care teams and hospice care teams will really focus intently on what is that person's wishes for their healthcare and making sure that those wishes are adhered to.
Heather, I loved how you framed that. It really reminded me of like shared decision making, how everyone should be actively leading in decisions about their healthcare. So I love that you ended with that, and I think that's going to be a great place for us to pick up after our break. So we hope that everyone comes back to our second half, which we're going to focus on my work at Gateway to Hope, and we're going to be talking to some amazing community partners, which help us do our work and help us really bridge a lot of these gaps that Heather has brought up in her discussion. So Heather, I was listening to you. You talked about risk factors. So we're going to do, so we have a 10-minute break. So I'm going to go get something to eat. And instead of grabbing a piece of chicken, I might grab a piece of fruit. So thank you for that little nudge. So 10 minutes, so if everybody could come back 6:07, then we'll jump right back in and we'll start to talk about, well, we'll finish answering the questions about palliative care. So we have questions about how do we make referrals, and then we'll get into our equity and advocacy work and our community partners, right? So I'm gonna get chicken, I'm gonna get fruit, not chicken, fruit, not chicken.
Lots of water, lots of water.
And waters.
Yep. See you back in just a few minutes then, guys.
Okay, I love Erica, like, wow. Okay, so we are back for our second half. Just want to thank Heather again for all that amazing information, and thank you for all the questions that were in the chat. So we still do have a couple of questions about palliative care, and I think about clinical breast exams versus mammograms, and we can cover that in our question and answer session at the end of our community partners presentation. So feel free to add whatever questions you like. If you would like any additional information on breast health care, educational materials, or materials about Gateway to Hope or Integrated Health Network or Valida's Hope, please feel free to put your information in the chat. I'll be putting contact information for all of the organizations represented here in the chat as well. We would love to hear from you. We would love to connect with you and answer those questions that you have. Okay, so I'm going to jump into my portion of the program, which is pretty easy. The work that I do, I stand on the shoulders of so many amazing advocates in breast health equity and care. The work that I do is I highlight the amazing work that's being done by Gateway to Hope and our contemporaries in the community. And I also have the opportunity to really shed light on a lot of the challenges that not only individuals have in navigating breast health care systems, but also the challenges and barriers that they face through social determinants of health, lack of insurance access, all those barriers that we as community providers and advocates know really create the disparities and the higher mortality rates that we see in the community. So while I say my work is easy because I simply highlight the work and the challenges that we're experiencing, it's easy in that way, but it is also so exciting because I get to work with so many amazing individuals. People always ask me, you know, why am I smiling all the time? Why do I laugh all the time? And it's because my work just puts me in contact with so many amazing individuals. And when you're connected and you work in relationship with so many amazing individuals, for me, it's hard not to smile because I see the passion, I see the endless dedication, and I also see the amazing outcomes that our partners have and that they create for everyone. So I love what I do. I love who I work with, and I'm glad to be able to present our community partners today. So what I would like to do is, before I present my amazing community partners, our amazing community partners, I'd like to talk a little bit about the new direction that Gateway to Hope is taking as far as advocacy. So while we heard from our amazing program department, all of the direct practice, patient navigation support that our program team offers, we recognize that that is only one part of addressing breast health inequity, right? So we're providing treatment, services and support, we're providing financial assistance, but what we really want to do is move upstream and catch people before they actually need a lot of these intensive services. So that is where our work is going. We're moving upstream to focus on what do we do to eliminate some of the barriers that create these later stage diagnoses, which are, result in later stage cancer diagnosis and untreatable cancers. So that's where we're moving. And the intervention that we've decided to use through our research in evidence-based practices is to create a statewide coalition. And that's what my work is. So we are looking at breast health equity systems in Missouri, and we're looking to talk with our community partners. We're looking to talk with breast health equity advocates to see what are the barriers that we are all experiencing. And some of the barriers that we're experiencing in St. Louis are also seen in Kansas City. And some of those barriers are also seen in rural areas as well. So we want to see what are the issues that everyone is seeing. And also what are the issues that individuals in Joplin are experiencing that maybe we don't see in St. Louis. So we're really interested in hearing from everyone, what are the barriers? And hearing from individuals, what are your barriers to being able to get to that mammogram? But we're also interested in hearing from providers, what are the barriers that you are helping to navigate individuals through? And we want to know what you're experiencing, what you're seeing in the healthcare landscape, so that collectively we can come together as breast health advocates, whether you're in St. Louis or whether you're in Kansas City or whether you're in Cape Girardeau, and we can start identifying what are some of these common needs. And when we identify what are the common needs, then we can develop statewide strategies, strategies that kind of go beyond what we do so well, which is orienting community resources. Communities are really good at knowing where the problems are and then filling those gaps. That's why we have these amazing organizations like Belita's Hope, like Integrated Health Network, who see the need and jump in with their passion and knowledge and meet that need. Communities are incredibly skilled and able to do that. We've been doing it as long as people have been living in communities. But there are some issues that require institutional accountability. I have a phrase that I say, I want to get tattooed on my forehead backwards so everybody can see it. We have to emphasize where individual and community responsibility stops and institutional responsibility begins. As a community, we can do everything that we can, but if we're still working within a broken healthcare system that really does not meet the needs of individuals, it doesn't consider the barriers that individuals face while they're trying to get the care, then we're constantly going to have to be navigating people through those systems. And the best case scenario is we want a system in Missouri that is equitable, affordable, accessible, and responsive to everyone in Missouri. That's what we want. So in a nutshell, that is the work that we are doing at Gateway to Hope. So if you are a part of a community organization, or if you're an individual that you're like, yes, she is talking my language, it's time for us to get together and do more, go above, go beyond, then feel free to reach out to me. We can talk about partner opportunities, or we can talk about what you're seeing and what you're experiencing in your community. So feel free to reach out to me. I'd love to hear from you, and I'd love to work with you, no matter where you fall in the community. I know we hear all the time, especially during COVID, we're all in this together, but we really are all in this together. So I'd love to hear from you. Give me a call. We can figure something out. So now I want to take this time to introduce, we'll hear from both of our amazing community partners. And first we're going to have Joyce Driver from Integrated Health Network. Yay! And I just have to say, within the last maybe 2 weeks or so, I have connected a lot of individuals with this organization. Sometimes with very short notice, hoping that they can help connect someone to be able to go get a doctor's appointment, or connect a community provider with the services that they need to serve their population. And I was just so inspired. I'm not a person to impress, but I was so impressed by the responsiveness that this organization had. I mean, literally, I was sending an email, they responded to the email, and they jumped right in to help. And those are the partners that, you know, we need. Those are the partners that type of partners that the community needs. So I was just super excited to be able to ask them to share this platform with us and talk about their services. So I'm going to read this amazing intro from Joyce. Everybody is amazing, but she's really, truly amazing. Joyce has spent many years working in the St. Louis community and strongly believes in the mission to work with marginalized populations. She has enjoyed working in both the public and nonprofit sectors, focusing on health and social issues for years. She has been with IHN since 2014 as a community referral coordinator in the ER department at SSM St. Mary's Health, and currently works as a community referral coordinator in the community-based program. She obtained a BA in sociology, social services from Webster University, and completed a community research fellowship at Washington University School of Public Health. Joyce's expertise includes addressing community health disparities and health literacy in underserved communities. She is active in the community through her community research fellows cohort and various community neighborhood organizations. And she is a breast cancer survivor. Yay, Joyce. So I am so happy to introduce to you all Joyce. Joyce, tell us what you do. Tell us who you are. We are open ears and just ready to learn from you.
Okay. As we know, I work for the IHN, and that's Integrated Health Network. So I'll be using IHN a whole lot. Basically, we are a part of the health network here. We're part of that safety net, trying to get those patients where they need to be when they need to be there. We started our CRC program back in 2007. At that time, there was only a handful of people. We were in the emergency rooms and inpatient only. But 3 years ago, we extended that invitation to the community, where Brittany and myself, with my cohort like Heather is, we started a program in the trauma zone, which everyone, you know, we talk about the trauma zone a lot, but the trauma zone is kind of extending itself. It's going south also, because you get those inequities everywhere you go, regardless if you're North County, North City, South County, they're everywhere. We also find that a lot of people don't have health insurance and haven't even considered it. And then that crisis happens. They get that chronic diagnosis and they're like, oh my God, what do I do? I don't know. And that's why I'm glad Gateway to Hope is around, and Vanita's Hope, because you all give those people hope. I'm gonna tell you a little something. When I was diagnosed 5 years ago, I didn't know about either one of you all. I knew absolutely nothing about you. My only saving grace was the fact that I had a good support system. Everybody does not have that. That support system and that ability to navigate makes a difference. It's night and day. When you have a patient who has insurance and is able to navigate, is a different story. But there are so many people who don't have insurance, don't have an advocate, don't have the knowledge to obtain any information they need. It's a horrible road out there. I have worked with the IHN since 2014, as you know. I originally worked with the St. Louis Health Department, where I saw a lot of disparities. St. Louis is packed with them, and it's not getting better, it is getting worse. COVID just kind of said, see, now you can see us. They've already been there. They've always been there. The pain is always there. So when you get a patient who doesn't have anything, it is so hard to say, oh, I want to take care of my health, when they're thinking about food, money. What am I going to do next? I'm out of a job. My kids can't go to school. All of those things put together. And then you tell them they got cancer. Oh my gosh, that's a death sentence in itself. Cancer is already that big C word that frightens us all to death. You're right, Vanita. You have to say, hold up, stop for a minute. I'm going to be there. And that's what the IHN does. The CRCs actually hold the hands of the patients. We get them into care. We find a primary care doctor, a specialist. We talk to them about Medicaid. We talk to them about affordable insurance. We talk to them. We actually are there with them. We guide them to you guys. And that's our biggest thing. If they need services from Gateway of Hope, that's where we send them. If they need Anita's Hope, go. You know, these are the things that we do. We are like the person that shepherds people. And basically what we try to do is get them involved, teach them to be advocates, because the best patient is one who can advocate for him or herself, or that person who can go out and get that navigator. Because if somebody's talking to me about, you got breast cancer, you got diabetes, you got high blood pressure, all of those things, those are so scary because they change everything in our lives. Right there in that minute, your whole life is thrown up in the air, and that's what happens. But when you've got these agencies and we know where they're at, it makes it so much different. It really does. So if you want to refer people to us, the information is in our in the chat. You can refer them. Then I have a business card. We call it a business card on steroids. Do you have it, Melanie?
I'm going to try to load it up there for you.
Okay, all right. Well, really what it does, it just tells us about, it tells you all about Brittany and myself, what we do, and it tells you about the Pulse program, which really tells you what the IHN's main mission is. And our mission is to get everyone into a primary care doctor, get the uninsured insured. It's really whatever it takes, we're going to try to do it. You have any questions?
I do, Ms. Joyce. So I love the online referral link. I've used it a couple of times. So
Oh.
I know I've used it as as a community provider. Can anyone use this referral link to refer maybe family friends?
Any agency can use it. All they need to do is get the referral. We would kind of prefer it came from the actual agencies that we're working with, because when you put in the referral link, you want to say what agency you're from and put your phone number in there so we can always call you back and get information from you if we need more information on that patient, or if we want to tell you something about your patient, we will communicate with you like that. And it's a secure HIPAA compliant format.
Okay, I do have a question. Okay, so I know that you're a community referral coordinator. So when someone reaches out to you, let's say they don't have an insurance and they don't have like a primary care person. So when they call you, I guess what should they be prepared to have any specific information, or how would you navigate that individual? Because we know that one of the things that we really promote is for people to have screening so they can have early detection. But we also know, you know, Missouri just expanded Medicaid, and I think we're still doing a lot of education that Medicaid is now expanded and available to more people. I think people still think about Medicaid being a program for, you know, families, women who are pregnant, women who have children. They don't necessarily think of like Medicaid being available to like people that are working but don't just have insurance available to their jobs. So can you talk a little bit about like, if someone comes to you and they're like, I have this need, I need to be connected with someone, but I don't have insurance. So you're able to connect them with what resources and able to be able to get them the healthcare access that they need.
Okay, I'm going to give you a little scenario then. Okay, say for instance, 35-year-old lady calls me up, and the number that's on the card and everything, anybody in the state can call. And what we will do is refer. You don't need to have anything special with you, around you, or anything. Just be able to sit down and talk. That's all it really takes. We don't have a lot of parameters of, oh, do you have insurance? Do you have income? We don't care about that. What we want you to do is feel comfortable enough to talk to us so that we can refer you to where you need to go. Because a lot of times, by the time people call us, it's like they have been thrown around every corner in the medical profession, and they don't know exactly who to turn to. So if they can talk about their situation, fantastic, because that way we can refer them. We can say, oh, okay, all right, so you need a mammogram. This is how you go about it. So you need a primary care doctor. Okay, let's get you signed up for a primary care doctor. And when we get you signed up for a primary care doctor, that's not just we saying, oh, well, you call this person and they'll give you an appointment. No, we call, we get the appointment, we follow through. We go back to the patient and say, hey, you got this appointment, it's on Monday of next week at such and such a time. Do you think you're going to be able to make it? And they say yes or no. If they can make it, fine. And we can say, hey, do you have transportation there? What else do you need? Do you need anything else? How is your food situation? We get into all of those things that deal with the determinants of health, because all of those things affect a patient's outcome. So therefore, once that's done, we can say, hey, okay, well, look, I know over here they're giving out food on such a day. I will call and make your referral. I'll make sure, or we've got a group here that will bring food to your house, because I did a whole lot of that during the pandemic. I had a lot of people needing food that would just call the IHN just because they saw it somewhere and they just really needed food. So that is something that we're not afraid of dealing with. Whatever it is the need is, we will deal with your need.
Yes, I can definitely testify to that, because that's what you did with some of my clients, and I was so grateful. So I just want to reiterate and just make sure that I heard it correctly and everybody heard it correctly. So if I have somebody that has no insurance, I could just call them, I can make that referral form and you all will take it from there. Because I think that is just such, I don't want to say passing the burden, but it is just such a help as an advocate to be able to say, I can make this connection, and especially that you all will actually make the appointments. I think that's absolutely incredible.
Yes, that's the part I really love. I think that's the part I love as being a CRC, is we get to follow through. It's just not like, oh, this is number 22 and okay, I'm finished with number 22 and let's go on to something else. No, it's like, okay, I can help 22. Okay, and do you have your appointment? You got your appointment? I'm able to hold a hand a little bit, because in this world, there isn't a whole lot of hand holding that goes on, and everybody knows that. You're sent here, you're sent there, you're shuffled off, and that's the end of it. But with us, we don't dump you because we're finished with you. Because I've had patients call me back. When I worked in the ER, I had patients that came through the hospital. The number was different than it is now, but they've called the IHN office and asked for me. And I'll get an email that says, hey, so-and-so, so-and-so, you helped my mother. Things like that. Those are the things that are fulfilling. Those are the things that wake you up in the morning and make you want to keep going.
Well, I appreciate it. I need you in my life. I need to have a personal referral line to you. I need a lot of hand holding. And we have it recorded. She said we can bring all our stuff to her and she'll handle it. So thank you. Oh, go ahead.
And the good part about that, if we can't personally handle it, we know how to find the resources to help you handle it. And that's the major thing.
That is amazing. You can see the smile on my face. I'm just so glad we were able to connect with you. You all have just made a big part of our job so much easier because I know you will handle it and you handle it well. So thank you so much. We're going to have opportunities for people to ask questions in our question and answer session. Please feel free to put your questions in the chat. I think we have a question that we didn't get to. Yes, so it's, can referral agencies come from anywhere in the state?
Yes. I've gotten referrals from Kansas City, but basically you have to remember we're working with doctors in the St. Louis City area. But if someone calls me from Kansas City and says, hey, I got patients, we got patients here, they can't blah, 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 I'll look it up. I will see if I can help. I won't just say, oh, well, I'm sorry, we can't do anything because we're in St. Louis. That's not the right attitude. If I can call up an agency in Kansas City and say, hey, look, I'm calling from the IHN and we got a lady here, blah, 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 then hey, that's what we'll do. That's why Brittany and I are community referral coordinators.
Yes, and that's why I need you. So I'll pay in cranberry and mango juice if you like. And someone put in the chat, more people need to know about this, and I absolutely agree. IHN has become one of my number one go-tos because they help with helping people get connected to insurance, connecting them to a provider and all the other social determinants. So it's really a one-stop shop, and I appreciate it. So cranberry and mango juice, let me know it is on the way.
All right.
Okay. And so next we're going to turn to Valita Keys, another amazing partner that I am so excited to be able to introduce and present. She does amazing, amazing work. And what I'll do is, before I read the intro, I will just say one thing that I really love about her practice. She is so committed to getting people to screening. I don't even think of the word mammography and not see Valita's face. That is how much she is just out there driving mammography. Mammography Mondays. It's Mammography Monday. Have you got your mammogram? Like, honestly, her face is tied to mammography for me. And like, I hope it's that way for everyone else. So I'm going to read her intro, which is, again, amazing. Valita is a 2-time breast cancer survivor. She's a mother, wife, author. Yes, breast cancer survivor, and an author of My Strength is Your Strength, book and journal. The book is available on her website, and I'll post that in the chat. She is also a licensed practical nurse, clinical navigator, emphasizing in breast clinical. She is the founder of Valita's Hope, which is a 501c3 NFP organization. She has won several awards for her community work, including Woman of Achievement and Remarkable Woman with Fox 2 Now. Valita's Hope has traveled to Durban, South Africa, and Cape Town, South Africa, to deliver recliners to underserved women that undergo a double mastectomy. Thank you so much, Valita. Due to breast cancer. Valita has been in several magazines, Red Book Magazine, Heart and Soul, and Gazelle. And she can be seen on Fox 2 Now on Mondays to remind women it is Mammogram Monday. So I want to show everybody, introduce everyone to Valita Keys. Valita.
Oh, thank you. Thank you. Thank you. Thank you. Hello, everyone. Good evening. Thank you so much for having me. Gateway to Hope, Melanie. Thank you for reaching out. As you know, when Melanie called me, I looked at the date. I said, oh, I can do this because today is Mammogram Monday. Today is Mammogram Monday. And you know that we have to make our appointments and keep our appointments. And if you're a woman, you know that you're at risk for breast cancer. If you're 40 years old, your mammogram is due. If you're 41, your mammogram is overdue. I looked at the flyer and it says being your own advocate, your own breast health advocate. So to me, when I read that, I said, that's pretty simple for me, because really being your own advocate is self-love, it's self-care, it's taking notes, keeping a journal, asking questions, making and keeping your appointment. You're not ignoring anything that looks abnormal. If it's something in your body that looks or feel abnormal, you're being your own advocate. You're calling your physician, you're making your appointment, you're keeping your appointment. And you're finding a doctor that you trust. You have to have a doctor that you trust in being your own advocate. And we must remember that no question is a dumb question. A lot of times we afraid to ask. We have to ask questions. And in making our appointments and being our own advocate, I will definitely suggest for women to make their appointment every year around the same time to remember. So if your birthday is June, just get it in your head to make your appointment in June for your well woman exam and for your mammogram. And we all know that insurance plans, they are governed by the Federal Affordable Care Act. So there's no excuse. What I'm saying is there's no excuse if you don't have insurance, because there are programs. We have the Show Me Healthy Women programs. And basically how you find that, and we all know that, you can just Google Show Me Healthy Women, and that's going to be a locator where you put in your zip code, and that will let you know where to get affordable pay for your mammogram and your woman's exam. As we all know that a mammogram detects tumors that cannot be felt. This is why you should know your family history. As you all know, if you read my story, if you know my story, I started getting mammograms at the age of 27. Right after a well woman exam, the nurse practitioner had asked me, she said, do you have a family history of breast cancer? I said, yes, my mother was diagnosed at the age of 36. She said, well, do me a favor. She said, I want you to get a mammogram every year without fail. And I did just that. So at 37, breast cancer was found in my left breast. At 39, a year and 5 days later, I was diagnosed again with breast cancer in my right breast. And this is all tied into being an advocate for myself. I listened to what the physicians told me. They told me to come every 6 months after the breast cancer. I came every 6 months for a mammogram and then an MRI that was induced to make sure that there was no cancer. Well, the cancer was back. And this was even after taking the medication tamoxifen. Tamoxifen is a medication that actually prevents breast cancer from coming into the opposite breast. Well, that did not work for me. The doctor told me to go home, to throw it away because it didn't work. And I also carried the BRCA2 gene mutation. I have had 7 surgeries in the last 10 years because I carried the gene mutation. So that with that gene mutation, BRCA2, it also lets you know that you are at risk for cervical and ovarian cancer as well. So I had to get surgeries to prevent me from even having that, because we all know, and if we don't know, that with cervical and ovarian cancer, the symptoms are asymptomatic. So you may not have any symptoms. And then once you do go get your yearly exam, you may be at stage 4. So to prevent that, I had a full hysterectomy and other surgeries to prevent cervical and ovarian cancer. So as we all know, that one of the reasons why I do this, because Black women are dying at an alarming rate right here in St. Louis, Missouri. And part of the reasons are because there are no resources. We are afraid. We are uneducated. So again, we must continue to make our appointments and keep our appointments. And we have been partnering with the library, the public library, since 2012. We've been with Rock Road Branch with Connie D for the last 10 years with the mobile mammograms. And it has been a huge success. We're at the libraries from at least four times a year, March, June, October, and December. We're at the public libraries bright and early in the morning. We have women come from all over, women that can't afford transportation that walk into the library. And I personally want to thank the library because it was a vision I had 10 years ago, going to the library, taking my sons, and I saw where there was a need, and the need was we need to have a mammogram van out here with this large parking lot. And Connie D, the manager, the branch manager over there at Rock Road, she agreed. She saw the vision, she agreed. And so I just want to say thank you again to the library. We have an upcoming date, December 18th. That's the last date of the year. And we want women to come out to use those those end of year insurance. It's not just for the woman that's underserved, but it's for the woman that works Monday through Friday, 9 to 5, and they have Saturday and Sunday off. It's for those women too. So that was part of the vision as well. I want to tell you all again that there is an initiative out here with the Pink Ribbon Girls, and it's called Treasure Your Chest. So when you get your mammogram now and you fit in these zip codes, you can get a $50 gift card from Snooks. Now, I think that's a very good initiative because everything has skyrocketed high. So why not use this $50 for your tax? So when you get your mammogram, you use this flyer. I have the flyer. Melanie has a flyer, but if your zip code is a 63074, a 63121, any of those underserved zip codes, you can get you a free gift card from Snooks, and we want to keep that in mind. And last but not least, I want everyone to repeat after me. The library is where your friends are at. The library is
where your friends are at.
The library is where your friends are at.
And if it's to be, it's up to me.
If it's to be, it's up to me.
Up to me.
So I want to say thank you all. Don't forget to visit our website at www.believershope.org. We're always excited to have partners and collaborations. That's where it's at. We need each other one way or the other. So I'm excited to be on this Zoom call with Melanie and Heather. I am always eager to talk about breast cancer awareness because I'm not only an advocate for myself. I never have to have a mammogram in my life. I always ask myself every day, why am I keep doing this? Because I'm sitting here with no breast yet, new breasts, giving my best. I don't have any breasts at all. I have had a double mastectomy with reconstructive surgery, so I don't have to have a mammogram. But I continue to do this for our women. I have an identical twin sister. I have a sister that will be turning 40 in January. So I am not only an advocate for myself, I'm an advocate for strange women, for women that are uneducated, for just women, period. That is my passion. That is what I do. I bring awareness in a very unique, winning way, and I will continue to do it until the job is done. Thank you.
Wow. I love you. I love your energy. I love your passion. Like, if I was not going to get my mammogram before you talk, you made me be like, yeah, I gotta go get it. And that's what I love about, your efforts. You're very just approachable. You're very educational, and you tell it to me like it is. You like, it's no excuse. Like, yeah. So I appreciate that because I personally need that drive. So thank you so much. And I loved how you talked about being your own best advocate. And as you know, working with collaborators and other community organizations, I love how you just demonstrated the power of collaboration. I mean, you have your organization, but you talked about all these connections that you have with the library, with Pink Ribbon Girls, with Gateway to Hope. And it speaks to what we need to do more in this region is collaborate, because no one of us can do this alone. So I just appreciate all that you do and you bring to this work. You're like absolutely amazing. I was trying to keep up with you in the chat. I mean, every time I posted something, you said something else, and I was trying to keep up with you. So I hope I put everything in there. We got your information about Treasure Your Chest. Thank you for bringing that up. We got the eligible zip codes. I know that you have the last mammography event coming up. I'm looking for the flyer. I did not have it. But can you give the number that people can contact with you so that they can make the appointment, or just let me know what you want me to put in the chat, because
Yes, you are. We've been partnering with Sidemen Cancer Center for the past 10 years. And that number is, I know it by heart because I'm telling it every day. It's 747-7222 extension 2. And basically what you have to do is hurry up and wait. Call that number, 314-747-722 extension 2. And it's about making your appointment and keeping your appointment. A lot of times we make our appointment and we just don't keep those appointments. This is with Sidemen Cancer Center. I heard Heather speak about the mammograms being 3D. They are 3D even on the van. So there's no excuse. The physicians are requiring you to come on out now, ladies. We are still really in a pandemic, but we're using precautions when we out there. Everyone has on masks. Your temperatures are being taken. We're giving out hand sanitizers. So if you're listening and you'll be listening later, there is no excuse. If you don't have any medical insurance, still not no excuse, because they have Show Me Healthy Women. Then if you hungry, you get $50. So come on, ladies, believe this hope.
No excuse. She's not taking any of our mess today, none of our foolishness. So we have some questions. How often do survivors need to get a mammogram?
So I would say, and Heather, you can piggyback off this as well. When it comes to a survivor, this will strictly depend upon your physician, because myself, I'm still in that age group of getting a mammogram, but I don't have to have a mammogram because I don't have any breast tissue. I have tissue, but I don't have breast tissue. I had a tram surgery, so that's my stomach muscles are up in my breast area because I couldn't get implants, but that's another story. So I would say this would depend on your physician, because if you had one breast removed, you had a lumpectomy, you still got to get that other breast monitor every year unless they say something different. So again, if you have had a mastectomy, is a mammogram necessary? With me, no. But if you have a single, which means one breast is still left, the doctors and the nurse navigators have to still monitor that breast that's still, it's a good breast. So they have to monitor that unless your physician say something different.
Okay, we had another question from earlier on. Is it enough to have a clinical breast exam? Do you need to have a mammogram as well?
Well, with the clinical exam, that's just a routine. I mean, and I don't want to say the wrong thing, but the clinical is just a routine that they normally do, especially if you're not at the age of 40. If you're not at the age of 40 and you have a family medical history, then that's where the clinical breast exams come in at. But that's just something like 21 years old or over for the clinical breast exam. And that's just part of your routine as you see the doctor for your well woman exam, or your monthly, your annual well woman exam, or your annual private physician appointment. So that will pertain to your age, I would say, and it will also pertain to your family history.
Okay, so like what Heather was mentioning, like your risks. So depending on what your risks are, Okay. Okay. So this is coming from a licensed practical nurse. So I feel very, very comfortable and confident with this information. Another question we had is, if you go to the MAM van, will you have same day results?
No, you won't have same day results, and I'm almost sure within that week, that Saturday, by that Friday, you should hear something. Because we get that all the time at the van. Well, can I get my results? No. These have to be looked at outside of here, and I guess it maybe take out, it just takes time. This is a mobile mammogram van, so it's mobile. So there you have everything. Is not microwave mobile, but we want to make sure that the results are the results. So you never get your results the same day. In fact, if you're having like some issues with your breast before you even come get your mammogram, they're going to ask you to make an appointment.
Okay. Okay. What are the most common questions that you get from women about breast health? That's a good question. Thank you.
I would say, and Heather, you can piggyback off this. I would say the most questions that Bleeders Hope we receive is the mammogram painful? And I can say this, I probably have had over 15 or 20 mammograms before the age of 40. So with that, a mammogram to me is just, it's not painful, it's uncomfortable. And so that's one of the main questions. And then the second question that we have as an organization is, will I die from breast cancer? Those are, that's a question that all women have asked. Will I die from this? How long will this pain be? Because the pain really comes after surgery. Most of the times you don't even have pain or anything when you diagnose. It's something that they see, like the mammograms are very important because they see the mammogram shows tumors 2 years ahead of time that it can be felt. So that's why we always on social media every Monday for 15 weeks for the last 10 years, it's Mammogram Monday, because a mammogram helped save my life twice.
Yes, well, I'm glad it did. I'm glad you're here talking with us, sharing with us, and really just, admonishing us to go and do what we need to do. I know I even kind of thought about like the uncomfortableness of having a mammogram, but I was like, I've had a child. I can get a mammogram. I can deal with the 8 seconds for each breast. I can do it.
Mhm.
So as we wrap up, it's amazing. We've gone through 2 hours with amazing information, but it's so needed. I just wanted to give everybody an opportunity to give like a final word from your viewpoint, from your service point. So Valita, since you are on my screen, right front and center, I'll let you have the first word, and then Miss Joyce, if you can follow, and then Heather, if you can wrap us up. I just want you to give your final word, final thought, final encouragement to everyone.
My final encouragement is, if it's to be, it's up to me. Make your appointment and keep your appointment, and let's continue to win together where we can.
Love it.
Hey,
Miss Joyce.
Okay. Thanks for having me. And I just like to say, if you need an appointment, don't hesitate to call. We will follow through with you. It's only a few seconds to call, but it's the rest of your life.
Thank you so much. Heather.
I don't even know how I'm going to follow up any of that. So many inspirational women on this call. I'm just so grateful and humbled to interact with you all on a regular basis. So thank you for sharing your story. Valita, your story is just so encouraging. Your passion, like I said in the chat, is just contagious. And Miss Joyce, thank you for sharing your story too. And just reignite sort of the work that Valita and Gateway to Hope and Melanie, we're all doing in conjunction, because we want your story. We want you to know that we all exist, right? So I'm glad the outcome of your journey has been a positive one, but we would have loved to have been there to support you along it as well. So thank you, Erica, for giving us this opportunity. And and this was all your idea. So thank you for presenting that, and we're super excited and just grateful.
Well,
And
thank you guys for coming. Thank you so much. What a pleasant surprise for me to meet Valita and Joyce, and so just motivated, encouraged, and excited, and am really hoping that, ladies, we can all get together and do this again. 10 more times. I don't know, however many more times we need to do it. I don't think there's too many times that we could do it.
Yeah.
I just think that not enough women, especially women of color, know that, Valita's Hope is out there, that Gateway to Hope is out there, that Joyce Driver does the work that she does. I had no idea until I reached out to somebody one day. So I was just so glad to be a part of it. And Angela Holland, I see your name on the screen. If you have any questions or you have any suggestions, feel free to type in the chat, or you can come off mute before we say goodnight. Melanie, thank you. Heather, thank you. Joyce, Valita, I so appreciate you guys.
Yeah. If I could just say one thing in the spirit of collaboration, I would just like to say that we are all in this together, and we need you. We need everyone. So please do what you can, do what you need to do so that you can be present with us.
Sounds like a plan.
Yes.
Sounds like a plan. Ladies, I'm super excited to do this again. I go back to the library on Sunday, so pretty sure you'll all see an email from me that says, hey, when do you want to do it again? So be thinking of some dates maybe in 2022. And I'm so excited. Thank you so much for coming. This was fantastic. Breathe. Thank you, ladies. Thank you all. Have a wonderful rest of the night. Enjoy the rest of the week, and we'll talk again soon.